Welcome, everyone. Thank you for joining us at Assisi's CE, hard to say quickly. We look forward to these opportunities to share great veterinary news with you and education. Today, the subject is non-pharmaceutical pain management, and we are privileged to have Dr. Janice Huntingford speaking with us. Dr. Janice Huntingford is a 1984 graduate of the Ontario Veterinary College, University of Guelph in Guelph, Ontario. She is certified in chiropractic, acupuncture, rehabilitation, and pain management. She is the owner and medical director of the Essex Animal Hospital, Canine Rehab and Fitness in Essex, Canada. In 2015, she became a diplomat of the American College of Veterinary Sports Medicine and Rehabilitation, and in 2018, she received her master's in traditional Chinese veterinary medicine. Dr. Huntingford is a consultant for the VIN Rehab Sports Medicine Chronic Pain Board. She lectures nationally and internationally on a variety of holistic topics, including rehab and geriatric medicine. She has co-authored several textbook chapters and published a number of peer-reviewed manuscripts. In her spare time, I laugh out loud when I say that, in her spare time, she enjoys spending time on her farm and winery with her husband, Harold, who is a well-known chef, and her pugs, cats, and horses, and oh, by the way, a few adult children. We welcome Dr. Huntingford.
Well, hi, everyone. I'm really glad to speak to you, and I hope everybody's staying safe through this whole pandemic thing. But we're going to get right into the non-pharmaceutical pain management part of this, and I'm going to start with a very interesting case that I had. I always like to start with cases because I think that makes us all start to think. So this is an 11-year-old female unspayed, nastier than the day is long American Eskimo by the name of Atari, was brought to me a week before this, actually on February the 21st. And this dog was completely paralyzed. She was flat out, could not lift her head, couldn't do anything. She belonged to a rescue, and apparently there was some trauma involved. It was very nebulous as to what type of trauma it was that had happened to her, but she came in paralyzed, and I'm talking to the person who's running the rescue, and I said, really, you want to spend your funds on this dog? And I mean, I treat everything that comes to me, but this dog was, it was just a little bit different because, you know, it didn't as far as I could tell, I wasn't sure that they wanted to spend all of the money required for rehabilitation for this. And the man who runs the rescue said, well, they had a sponsor for this dog, and she is very interested in making sure that this dog recovers and gets a good home. So this was our second treatment of her. She's not flat out here, but she could get up in this position now because it was easier to bite from. The one good thing is that she did bond with one of my technicians, and this is Mel, in the treadmill with her. So this is a couple of weeks later where we have her in the treadmill. And if you've seen videos of underwater treadmill, you will know, I don't know why that's not running for me. It seems odd to me. Should. This dog is walking the wrong way. And I don't know why she's not walking. Wow. Let's see if I can pull this along. No. I guess maybe I should have figured out if my videos were going to run, but not had any problems with them. We'll see if they're all like this. Let's see if this one will work. This one will work. Don't know why the other one wouldn't. But here she is. And she can move around. At least she can sort of stand up. You'll see Mel trying to put her and get her to stand. So she can do that a little bit. And this one was March 28th. So she's walking sort of like a drunken sailor, but you can see that she is walking. So this has been about 5 weeks. what we did with her after this. Obviously, we did acupuncture. You saw that. She was on some pain medicine. She was on some gabapentin, and we did underwater treadmill with her. We used, we had the foster using the Assisi Loop with her twice a day. And of course, we were doing some exercise therapy. Whoop, and there she goes, capsizing. And this is the 18th. And here she is walking pretty well. So of course she wasn't really very nice, but she did bond with Melanie. So of course Melanie adopted her and went on, and we spayed her and cleaned her teeth, and she's, you know, doing really well today. So this is just a great example of what can happen with integrative non-pharmaceutical management along with some pharmaceuticals. So one of the things that we are treating an awful lot when we're doing rehabilitation, when we're doing pain management, a lot of times we are treating osteoarthritis, degenerative joint disease, really. And just a little bit of a review on how degenerative joint disease works and what happens. Let's see if I get my pen here. So we will have some tissue destruction that happens right here in our joint. And of course, remember, we have cartilage, we have a synovial membrane and synovial fluid. And really, osteoarthritis starts with a synovitis. But what happens on a microscopic level is that we have inflammatory mediators that are released. So we have our prostaglandin E2s and our other nasties, our tumor necrosis factor alpha, for example, our nerve growth factor, all of these things get released. And causes an increase in our matrix metalloproteinase production. But don't forget, a joint is always coming and going. There is also tissue inhibitor of matrix metalloproteinase, and that is supposed to be able to balance out your matrix metalloproteinase as the joint is repaired. We have things that are breaking down and things that are building, and we always do that. But unfortunately, when we have synovitis, we end up with a decrease in our tissue inhibitor of matrix metalloproteinase. So our matrix metalloproteinase, which is our breaking down proteinase, it goes wild. And so we end up with increased cartilage damage, which releases more of our inflammatory factors. So it becomes very much a vicious cycle. Our synovial inflammation does decrease our hyaluronic acid. And remember, the hyaluronic acid is the thing that's lubricating the joint so things are moving very smoothly. We get plasma leakage into the joint, and that's going to dilute our hyaluronic acid. So if you've ever taken a sample from a joint that has osteoarthritis, you'll know that the joint fluid seems to be very, very liquidy, and it is, because there's decreased viscosity and the ability to lubricate the joint, because we've got plasma that leaks in there and dilutes our nice motor oil, if you want to think about that. So we have an increase in our cycle of pain and our cartilage degradation. So what do we do about that? Well, we want to do pain management, because remember, synovitis is the part that is very painful. If we're looking at our joints, are things like our cartilage, they're aneuro and alymphatic and avascular, and they don't have pain receptors. But in the synovia, in the synovial lining, there are silent nociceptors, which are just waiting there for something to happen to the synovia, and then they start to go off. So it's important to manage those things with drugs, and then also without drugs. So we like to integrate those things, because we know that multimodal pain management works far better than just using drugs alone. And so this, of course, is showing one of our little kitty cats with lots of acupuncture, because we do lots of acupuncture in my practice. So just a little reminder, what drugs can we use for degenerative joint disease? Well, of course, nonsteroidal anti-inflammatories are really the #1 drug that we're going to use in dogs and perhaps in cats. Cats, of course, are a little bit different, and we know here in Canada we can use meloxicam at a low dose long term with our chronic pain cats. I don't think you have anything that's licensed in the US. for long-term use. There are things like Graphoprant, which is really for dogs only, and people are using tramadol, opioids. Gabapentin is the #1 pain drug that's used in cats with osteoarthritis, rightly or wrongly, but we're not discussing that today. And then amantadine and amitriptyline those are the ones that we generally are looking at using. I just wanted to bring this up, although this is really non-pharmacological pain management. This is a new thing that's coming out, anti-nerve growth factor. And for those of you who are interested in reading papers, this is one that was written by Mark Epstein. And there are a few other of these anti-nerve growth factor papers, but this is a really good overview. And so if you're interested in finding out about this, I would definitely read the paper. But this is a new emerging thing. Hopefully this will be on the market, at least in the US, in the fall. That was what they were planning on in I believe in February, when they were talking about this at the Western Vet Conference. But who knows, with the way the world is now, whether it really will come out this fall. But let me just share with you how it works briefly, because it's kind of a cool thing and I think we probably should know about it. So what happens is that obviously there's chronic inflammation, and there is peripheral sensitization and central sensitization that happens in the affected sites and also in the dorsal horn of the spinal cord. And we have to remember that peripheral and central sensitization have the effect of lowering the neuron firing thresholds, and they increase or exaggerate the fields of pain that are in the dorsal horn. And what happens is um, when we have joints that are having an issue, they are going to upregulate things like nerve growth factor from the endothelium, epithelial, immunoreactive, and the spinal glial cells. And nerve growth factor is a very critical component for hypersensitization. So for chronic pain, this monoclonal antibody is an anti-nerve growth factor, and it's been developed by Zoetis. So this it's going to be given by monthly injections. So it's supposed to work for 1 month or perhaps up to 6 weeks. And the cat one is supposed to be the first one that is going to come out in September of 2020. And I listened to Dr. Duncan LaSalle's talk about this, and he called this fairy dust for arthritic cats. So I'm interested in seeing the fairy dust. So that's my bow to the pharmaceuticals. And now we're going to talk about the things that I think are a little bit more interesting, which is nutraceutical and herbals. And as you can see, this dog is in a field of hemp, and I have maybe one slide here on hemp for those of you who are interested in knowing about that. We could have an entire presentation on CBD and hemp, but we'll talk a tiny little bit about it anyways. So let's talk about something that we probably all use or think about using, which is going to be fish oils. And how do fish oils, which are eicosanoids really, that's how they act, how is it that they work? Well, if we look here on the left side, if our phospholipid membrane contains arachidonic acid, when it breaks down, when it breaks down, it will release arachidonic acid. Arachidonic acid is broken down by the COX system and also the 5-LOX system. When that happens, we come all the way down here and get all of these nasty prostaglandins and our thromboxanes released. And all of these have the effect of promoting and stimulating inflammation, pain, and all of these little inflammatory mediators. Now, this is interesting because we do know our non-steroidal anti-inflammatories are going to be COX-1 sparing, COX-2 selective, and the inducible COX is the one that we want to block. That's going to promote inflammation and pain. And we know we certainly have NSAIDs that are going to work at this level. We really have no pharmaceuticals that work here on this at all. So that's an interesting thing to think about. But what happens if we take high levels of eicosapentaenoic acid internally, so omega-3 fatty acids. If we take those internally, when our phospholipid membrane breaks down, it's going to release our eicosapentaenoic acid as opposed to arachidonic acid. The eicosapentaenoic acid goes through the same two enzyme systems, but we have weak neutrophil chemotaxis up here, and we also have decreased stimulation of our inflammatory mediators. So that is how our omega-3s, our fish oils, our green-lipped mussels, that's how they're working, is they're working by decreasing the inflammation. But this is why we can't expect that we're going to be giving eicosanoids and we're going to have them work immediately, because it takes a while for all the membranes in the body to absorb your eicosapentaenoic acid and get rid of the arachidonic acid. So our fish oil studies there's a lot of evidence that fish oil works. It does work to decrease inflammation and pain, and it's going to improve weight bearing. And as I said, it can take up to 8 weeks to work. And this is the osteoarthritis dose for dogs. This is 100 milligrams per kilogram of EPA and DHA added together. And people will tell you that this should be the starting dose. And really, the amount of fish oil that you're going to give a dog, you're probably not going to ever get close to the toxic dose, which is about twice this 200 mg per kg, because you generally end up with diarrhea. But the important thing is that most of your veterinary pharmaceuticals, that are pharmaceutical nutraceuticals, if you want to think about them rather, are going to have very, very low amounts of the EPA and DHA, because most of them are really made for dermatological problems. Now, if you're treating derm cases, you don't need to go necessarily that high. But if I'm treating a derm case, I use this dose anyway, because I just use the osteoarthritis dose. So you can start there and you can go up. Just remember, if it says 1,000 milligrams of fish oil, that does not necessarily mean there's 1,000 milligrams of EPA and DHA. You need to look and see what they are and see what your capsules are. So in general, I'm using human capsules that I have the clients get. I will have them pick those up, because most of the veterinary ones, if you add up the EPA and DHA, have probably about 300 milligrams in each capsule. If you have a 10 kilogram dog at this dose, he needs 1,000 milligrams. He's going to need at least 3 of those capsules, and that's just only a 10 kilogram dog. Most of our dogs are 40 kilograms, 30 kilograms. So I like to get the human ones that have more like 900 milligrams of EPA and DHA. They tend to be marketed for people with heart issues. You can get them at Costco. You can look on consumerlab.com, and it will give you some of the really good ones that are the high doses. Now, here's something interesting. The cat dose for this is 50 mg per kg. Don't go over that with cats, because the kitty cats can get bleeding problems. Your dogs will not. Your cats certainly can. So that's the maximum dose that you want to use. I've had other people ask me also about vitamin E. Vitamin E will not be bound overly with these dogs on high dose fish oil, because most of our commercial diets, actually all of our commercial diets, have enough vitamin E in there that it's not going to cause a problem. You do need to worry if you have a dog that's on a funky diet, a homemade diet, an unbalanced diet, then they might have to slip in a vitamin E capsule if they're using high dose fish oil. So this is another one. When I was speaking in Asia, they use this particular product quite a bit, Antinol, and it is a proprietary Greenlipped Mussel muscle product. There are a few head-to-head comparisons with fish oil for the treatment of osteoarthritis. You do get improvement with this after 2 weeks, and I had a research project at my practice where we did this, and we did see improvement after 2 weeks, and still these animals were doing well after 12 weeks. The thing about this is you don't have to give so much. It's a very small capsule. You can use it in dogs. You can use it in cats. If you have to open it up and squish it out, it's only a few drops and seems to work quite well. Another favorite nutraceutical of mine is Avocado Soy unsaponifiables. This has really good research behind it. And this is the paper right here, the Bolio paper. If you are interested in reading these and you needed to, you can always email me and I can send you these papers. But I always like you to know that if I'm recommending a nutraceutical, there's a reason that I'm going to recommend it, because there's some research behind it. So we find this in our Dasaquin. Dasaquin has the avocado, soy, and saponifiables in it, and now their new one has added some other herbals that I think actually probably work better than the glucosamine that's in there. So another favorite nutraceutical of mine is one called undenatured collagen type 2. So what exactly is that? Well, it comes from chicken sternums, and the idea works different than any other nutraceutical, and you don't have to give it in a huge amount either. So the idea is that healthy, undamaged cartilage is not seen as foreign by the immune system. However, once the osteoarthritis has damaged those collagen, there's collagen fragments that are released into the synovium, and that's going to stimulate an autoimmune response against type 2 collagen, and that further damages the type 2 collagen in the joint. So again, we get this vicious cycle of joint degradation and sensitization. So what is this? How does this work? Well, as I said, it comes from chicken sternum, and UC2 is different than hydrolyzed or denatured collagen because it still contains our active immune modulators, and those reduce the secretion of enzymes that break down the type 2 collagen, so it slows down our immune response. So really what happens is by giving this orally, we get oral tolerance that's going to develop when the immune system gets exposed to these antigens. So really it's almost like orally vaccinating your dog against osteoarthritis. And so I have used a fair bit of this and been very impressed with this. There's some nice research projects on this, and the dosage you need to use is not very much. This is one that we may or may not have ever read. It's from the Journal of Animal Physiology and Nutrition, which is probably why most veterinarians are not aware of it. But the product that I generally use is Flexidin, made by Vetaquinol. They did a very interesting project. They didn't, Dr. Gupka did, where they took 4 groups of 25 dogs in each group. And what they did, these 4 groups were either a placebo, they had undenatured collagen, they had glucosamine, and then they had undenatured collagen type 2 plus a glucosamine chondroitin. And what they found with this was actually very interesting. All of these dogs had osteoarthritis, and they did veterinary and owner subjective scoring on these. And what they found was the 2 groups that had the undenatured collagen type 2 in them, either the glucosamine chondroitin and UC2 or the UC2 alone, did better than the glucosamine chondroitin on its own, and obviously better than placebo. But the very interesting thing is that when you combined glucosamine chondroitin and UC2, it didn't work as well as just UC2 on its own. So sometimes when you're combining these nutraceuticals, you have to be careful that you don't combine ones that are not going to be synergistic. So if you want to use this UC2, you need to use it in a form without glucosamine and chondroitin, or you need to make sure that your client is not also giving glucosamine and chondroitin, because it's not going to work as well. Now, how about some other common Western herbals? And I'm not talking about a lot of these, but a few, and the ones that I find that most people ask me about because their clients are asking them about. And I think Boswellia is one that a lot of clients are asking about. And they've read about it online. They know that it's an anti-inflammatory. They know it's a pain reliever. There are a few things that they don't know about it. It can be given with NSAIDs. It does help for arthritis, and it does help for inflammatory bowel disease. Now, when I use this, I tend to use it in a combination herbal supplement rather than on its own. And I think that that's probably the best way to do it, is to use it in a good combination, maybe one with turmeric or something along those lines, because I find that it works better, and you usually can use a lower amount of it. Now, why are we interested in using this along with our non-steroidals? You remember that I told you that the non-steroidals are blocking the COX system? Well, our Boswellia reduces the 5-LOX activity as well. And so what does our 5-LOX does? Well, we saw that it produced, increased the production of leukotrienes, and the leukotrienes are the things that are going to help cause our diseases of inflammation. Also, they're going to be cancer promoting, and they are going to activate cancer cells and cause tumors. So if we use Boswellia, we're going to reduce this entire system. So that is a great herbal to use, and one that can be used in dogs. It can be used in cats as well at a lower dose. And one of the other herbals that I'm asked about a lot is turmeric or curcumin. Turmeric contains curcumin, and curcumin is really the active ingredient. The turmeric or turmeric is the name for the spice that's used in cooking. Now, when we use curcumin in dogs, we're probably better to use things that are more of an extract. And there've been a couple of studies on using curcumin, and there have been positive and negative. Both of them really showed some limited benefit where the owners didn't report a lot of significant difference, but some of them had positive objective 4-state data. So it's a little bit hard to interpret. The human dosing of this stuff is about 100 to 150 mg per kg twice a day. 30 mg per kg once or twice daily, unless you're using more bioavailable forms, is probably what's suggested by the human literature. And there are a couple of veterinary forms of this. I think the RX Vitamin people now make a curcumin formula, which is pretty good. If you're using the human formula, you're using things like Curcumin, that sort of stuff. But you can, again, find some of these in combination supplements, and those might be of interest. If you are giving just straight the turmeric spice, you have to add black pepper, and that does make it more bioavailable. I think what you need to know, and when you're looking at some of these veterinary supplements, you need to know about this, that if you take the regular spice, it's about 0.5% bioavailable. If you add black pepper, it becomes double that. It becomes 1% bioavailable. Now, there is a product that's made by Nutramax that has a turmeric in it that's 5 times more bioavailable than regular turmeric. So 5 times 0.5 is still only 2.5% bioavailable. Some of these other human products are up around 10 to 15% bioavailable. So I kind of like to use those. Now, we're not going to talk an awful lot about hemp, but what we do know about hemp has probably come out of the research that's been done at Colorado State, or that has also been done at Cornell, where they did use a CBD product, and they did find that it worked for dogs who have osteoarthritis. The thing about using CBD products is you really need to know what your licensing body has to say about them in your state or in your province. Certainly here in Canada, although it's legal federally, there's no veterinary product that's been approved by Health Canada. So it's difficult for us to say you can use this product or you can use that product. But the College of Veterinarians of Ontario, I practice in Ontario, has put out a few guidelines, but where you're really supposed to use the human products from the store, from the government store for pets, because people can go in and buy them. But I think what you need to do is really become interested in if people are asking you about it, become educated in this. And there are many websites that you can go to. You know, maybe we'll have another webinar just on CBD. Happy to do that. Or the other thing I can do is certainly share any information, but it would be a very, very long thing if I could spend the rest of the morning talking about CBD. But just be aware that it's out there, and that as veterinarians we really need to educate ourselves so we can educate our clients as to which products are good and what we need to look for. So let's talk about some of these other non-pharmaceutical treatments for osteoarthritis. And we're not talking really much about pain assessment. I've talked about nutraceuticals already. And we're going to talk about a few other things that we can integrate when we're looking at treating our patients. And obviously these little pugs are not, do not have osteoarthritis, but this just, I have this here in my osteoarthritis lecture just to tell you one thing. I'm sure you see many of these little tiny dogs who come in when they're puppies and they have luxating patellas, and you kind of tell the clients, well, these are sort of normal abnormalities. Your dog may never have this problem, but you might have a problem later on, and then the dogs are going to get osteoarthritis, and then what are you going to do? Well, then you treat the osteoarthritis. So I want you to start treating them at this age with these little dogs that are under 20 weeks of age. What you can do is you can have the owners teach them to do sit to stands and have them do hundreds a day, or at least as many as you can get them to do. Because if you do that, these dogs are plastic at this age. They aren't plastic at the age of 2 or 3, but they're plastic. And if you strengthen that quadricep muscle and you groove out that patellar groove, many of these dogs' knees tighten up and they never have problems later on. And I've done that with many puppies. So there's one way that we can prevent osteoarthritis, at least in these little dogs. So another pet peeve of mine is dogs who are overweight. And you know what? 50% of these dogs are overweight. And the reason that I have this is that if I always tell people, if you have a dog who has osteoarthritis and you can't afford to do anything else, the one thing that you should do is weight loss, because a 6 to 9% weight loss in these animals is going to decrease the amount of inflammation that the dog has, and many times it makes them able to walk much more normally. But remember, it's not just about excess stress on the joints. Fat is pro-inflammatory. And what this actually means is that our adipokines are releasing a number of these pro-inflammatory mediators and driving diseases of inflammation, like diabetes, like osteoarthritis, because they're releasing tumor necrosis factor alpha and interleukin beta 2 and 10 and all of these ones that are pro-inflammatory. So it's not just about stress on the joint. It's also about that fat. I tell my clients, fat equals pain. If we can decrease the fat, we decrease the pain. So how about other fun things that you can easily do in your practice with animals who have osteoarthritis? What can you recommend that clients can do? Well, this is a dog who has a cold compression device on it. This is Companion's cold compression device. There's a few other ones on there. It's really made for post knee surgery, but you can use it in other places. You can use it in elbows. You can use it in knees that are just sore, not necessarily after surgery. You can use it after exercise or painful modalities. You might want to use it after shockwave, something like that. But ice itself is really very, very good, and you're able to use that several times a day. You remember that it's only superficial. You don't have to use a very cool cold compression thing. You can make up ice packs of your own by by using alcohol and water and a little bit of food coloring and freezing them. Or we just use a lot of the ice packs that we get that our vaccines are packed in that come from our suppliers, and we'll use those in our rehab as well. There are other really nice little beady cold packs that you can get that are cold and hot packs, and so you can use those, and great to have the clients use them, obviously watching for hypothermia, and you don't want to cause frostbite or any of those sorts of things with that. And what about heat? So we can use cold, we can also use heat. Well, a few things about heat. We need to remember that we don't want to use any kind of thermal therapy within 72 hours of surgery. Why is that? Well, because thermal therapy increases circulation, so we really don't want to increase circulation to a surgical area. It does a few other things as well. It's going to help relax muscles and do that kind of stuff. But generally, you're going to wait until the acute inflammatory phase is done. And so what are the benefits of our thermal therapy? Vasodilation, obviously increasing circulation. It helps really to decrease tissue edema. It does help for pain relief. It's going to help with our muscle spasms and relax the muscles. And we like to use heat before we do any stretching in rehab, because then we're going to get a better stretch. Our precautions obviously are going to be active bleeding immediately after surgery, open wounds, and areas of impaired sensation, or obviously acute inflammation. Very old and very young animals, we don't want to use those in. And laser therapy is something else that we will do a lot of, and it's very, very popular now. And at least 20%, and maybe it's more than 20% now, but at least 20% of veterinary practices have lasers. So the question is why? Well, a lot of these things are client driven. I'm sure your clients are like mine. Yes, they're okay putting their animals on meloxicam, but if they have a 3-year-old Labrador Retriever who has mild to moderate hip dysplasia, they're not interested in doing surgery, and not even sure I'd be recommending it, but they don't like the idea of saying, okay, your dog is 3, it's going to live to be 12, it's going to be on meloxicam every day of its life until its death. They don't like that idea. I don't like that idea either. If I can reduce the amount of non-steroidal anti-inflammatories, I would like to do that. So clients are really wanting non-pharmacological options. We do a lot of laser therapy in rehabilitation, and I've had a laser since 2005, and the products are just a lot better. There's a lot more laser research that's been done. The products are safe, and they can be, you can train staff to use them, and they work. So laser is going to work for wound healing, pain relief, edema, inflammation, muscle spasms, and it does help to increase circulation as well. Now, I did a laser research project. I don't think I have the slides on that here, but I did one on elbow arthritis in dogs, and we found that if we did laser with these dogs, that we were able to decrease the amount of non-steroidal anti-inflammatories that were given to these dogs after they had had 6 laser treatments twice a week for 3 weeks. Then we were able to reduce I think we had 9 out of 11 dogs. We were able to reduce or eliminate our non-steroidal anti-inflammatories. So that was a pretty dramatic result. So I am a fan of doing laser. I think it's a great modality. Another modality that I think is also really wonderful, so I'm very happy that Assisi is sponsoring this talk because I am a fan of the Assisi Loop. And for those of you who aren't super familiar with it, it's pulsed electromagnetic field therapy and has a very interesting history. It was cleared by the FDA for humans post-surgical, for post-surgical pain. And actually, the big study that was done was on women post-mastectomy. And what they found with these women, they used the Assisi type device that was bandaged into their surgical incision. And it was one of these devices that would turn on and off itself and give, I think, a 15-minute treatment every hour. But there was a significant reduction, like 50% in narcotic use in the women who received this targeted PMF versus the ones who did not. And there was also a significant reduction in inflammation, post-surgical exudate, and there was a reduction in interleukin 1 beta. So this is very cool. And this is, of course, showing some Assisi loops on our dogs and our cat friends. So when people ask me about this, they're kind of like, well, how could this little loop actually do anything? What really happens? Well, this is sort of a way to think about it. If you look at the left, we have a healthy cell, and that healthy cell has a very balanced distribution of sodium and potassium ions. The one in the middle is a diseased cell. You see that the ions they've migrated, some to the inside, some to the outside, and they migrate until there's a complete electronic discharge of the cell. However, if we're using some targeted pulsed electromagnetic field therapy, that our field therapy strives to uh, bring about a normal distribution of our sodium and potassium ions. So it brings it back into balance. So we need to remember that it's a disruption of the electromagnetic energy in the cells that causes impaired cell metabolism. And this is the final common pathway of disease. So if the cells are not healthy, the body is not healthy. And this is simply showing you a little bit about the cell potential and our membrane potential being 70 to 90. And that's really, those are the sort of things that we want to happen. With our targeted pulse electromagnetic field therapy, the reason that this is important versus just other pulse electromagnetic field therapy is that if we have the proper field intensity and the proper frequency, that's what we need to modify the disease. So our targeted PEMF is going to affect our calcium calmodium dependent pathways, and it's going to increase our calcium binding to the calmodium. And when that happens, it brings about an increase in our nitric oxide. And when our nitric oxide is increased, it increases our growth factors and it releases pain, decreases, something like that, pain and edema right away, because our nitric oxide instantly increases the blood flow. So this is what we're looking at with our targeted PEMF. It's really increasing the nitric oxide activity. So what are the things that it does? Well, it's going to increase the tumor, the growth, not tumor, the transforming growth factor beta 1. Blah. Transforming growth factor beta 1. It's going to decrease our inflammatory cytokine interleukin 6, and it's going to decrease our prostaglandin. It's also going to increase the growth of our osteoblasts. So this is sort of showing the effect on a fracture. Now it's very interesting because I have used these in animals who either had non-unions or delayed unions and been very, very successful using the targeted PEMF. So the Assisi group has done a few very interesting studies. This is an older one, but they did one where they compared this 20 days of Assisi PEMF to 20 days of Previcox. They both showed significant improvement in pain and functionality during the study. However, the ones who received the Previcox, the relief ended shortly after cessation of therapy, and the Assisi Hemp effects were still in place up to 12 months in some cases after the cessation of therapy. And this is a great paper that was recently put out and was published in the Journal of the American Animal Hospital Association in 2019. And it came out of the group at the Animal Medical Center. And this was a double-blind placebo-controlled trial that showed targeted PEMF administered to 53 client-owned dogs that had hemilaminectomy. And it was randomized, so they either got a sham treatment or they got targeted PEMF, and they evaluated wound healing and pain medication. And they found that the dogs who had received the PEMF, they were significantly improved wound healing versus the ones who didn't. And also they required less pain medication. And there was no untoward effects that were recorded in either group. So this is a great paper showing how well this works. And this is simply showing some of your Assisi loops. The ones here on the right are very new. This is our loop lounge. I love this thing because this is like a sleepy pod. It has a couple of Assisi loops in it. When you talk about non-pharmacological pain management and what are you going to do for these old osteoarthritic cats, the clients simply put the cats in there for 15 minutes twice a day, and it treats them very, very well. This is a pad for use in clinic, and so you can put your patients on that. And we have found that dogs need less opioids if they're using these on a regular basis. So I like to send these home for the clients to use at home, along with a lot of our rehabilitation therapies. So what else do we do that's non-pharmaceutical? Well, I have an underwater treadmill. Why do we use this? It's a great way to build muscle, good for thermal effects, helps stimulation for our neurological patients. And can you do rehabilitation without it? Absolutely. But, the clients do like to see some of these cool things. And it does work very well for, for our building of muscle. Absolutely. And we do use it in dogs and cats. Here's one of our cats in the underwater treadmill. So this was Fat Louie. He was actually in there to help him lose weight, and he has some arthritis, so this was helpful for him. The other water therapy people often ask me about is swimming, because they want to take their dogs and put them in the pool, and they figure that that's a good way for them to do rehabilitation. Well, not necessarily. Maybe if they have generalized arthritis or for forelimb conditioning, core strengthening, it's very good. But if they always want to put the dogs in there when they have a cruciate rupture, and I'll show you a video here. Whoops, let's get away from my pen and see if this guy will work. Oops. So this is in my pool. We have a lovely underwater camera. Notice this dog's right hind leg. Every now and then he's using it, but a lot of times he's holding it up. He's using it enough that if the client really wanted to use it for therapy, okay, that might be an okay thing to do. But in general, they're not using their leg all the time. And if you put them in after they're okayed for swimming and they haven't had enough rehabilitation, they just swim with 3 legs. They're very, very smart. So how about exercises that every practitioner can recommend? I think that this is important. We can all recommend exercises for different things. Cavalettis are without a doubt my favorite thing to use for geriatrics. We like to use them as part of an obstacle course for these dogs post-surgical. But Cavaletti's great for pain relief, flexion and extension, weave cones, backwards walking. All of these things are going to be good. They're going to build up your hind leg strength. High fives, those are easy to teach to your dogs. And then uneven surface walking, you can use Bosus. You can walk in snow. You can walk in deep sand. You can walk in the leaves. And then things like cross-legged standing, which is picking up one front leg and the opposite back leg great exercise for core. Obviously, sidestepping, hill walking. I'll show you a few examples of some of these things. So this is our cavalettis. We've made these cavalettis. You too can make them, or you can buy them for a lot of money. But these are PVC pipe with red hockey tape on them, and then just cones that we have that we've drilled holes in. And this is a little neuro dog coming in for a bit of therapy. And so they're great for neurological cases. They're great for geriatrics. If you can encourage the dogs to walk over them, this is the owner doing that. I usually like my staff to do it, but you know, the owners like to do these things. And then environmental modifications. These are all things that we can talk to the clients about if they have animals with osteoarthritis. Carpet runners, rugs, elevating your dishes. Don't forget about baby gates, and then harnesses, assistive devices, slings, those sorts of things. Don't forget about access to the litter box for these old cats. They need to have things that are lower, or they end up pooping outside the box. And then assistive devices, this is a help them up harness. If you've not used this with your old geriatrics, great thing to do. It allows especially older people to be able to care for their dogs. There's a front and back end piece, and they have, it's almost like suitcase handles, so they can help pick the dog up. But there's many other things you can use: power socks, anti-knuckling devices, ramps, medical pet shirts. This is a canine anti-knuckling device that someone made for dogs with wobbler's disease, but you could easily put a harness on that dog and use some TheraBands to pull the legs up like that, rather than spend lots of money on this particular device. So obviously booties and wheelchairs are other things that we will sometimes use. Sometimes dogs get osteoarthritis so bad that they do indeed need something like that. And then I wanted to show you something with medical pet shirts. So these are like the shirts you're going to put on post-surgery. You could also use thunder shirts. I want to show you this particular dog who is a neuro case. You can see how he's walking. A little bit wobbly, not so fabulous. So we put a medical pet shirt on him, and and here he is walking better. So this actually is a acupuncture, acupressure, T-touch technique, but it's certainly something that anybody can do. And I do these, it really works for dogs who have T3 to L3 myelopathies. Not really for all dogs, but T3 to L3 myelopathies like these dachshunds get, definitely a great thing. And acupuncture, something that we do all the time, very, very good, drug sparing. You saw our little Atari, and the acupuncture really got her going. That and the Assisi Loop that they were using with her, really, really very helpful. So I just want to finish with this case. I think I have a couple minutes left, but I wanted you to see this case of Karma. And Karma was a 1-year-old intact female mixed breed dog who came in post-op. She was non-ambulatory. She'd had a what did she had a hemilaminectomy done. She'd had an issue with her legs as well, so she was non-ambulatory in her hind legs. So here's what we did. We iced her twice a day. She got passive range of motion, stretching, acupuncture, laser, and obviously she had her Assisi Loop, which I didn't put on this slide. Silly me. And she's getting laser. So a couple weeks post-op, let's just turn this volume off. Here she's walking over some things. And we continued to do her Hemp, and we continued using a few other things with her, and she's not doing too badly. And here she is 2 weeks post-op. We're doing just some balancing with her, and that's something that's fairly easy to do on some of these little fit bone things. And we've seen this one where she was walking over her cavaletti. Oops. This is just her in the treadmill. There you can see her surgical hip incision there. She's not wanted to use that leg very much. But there we have, this is Dr. Ron Coe who's in here with her, trying to get her to swim. But see the swimming? She's not using that leg. So that's one reason that I'm not so keen on swimming. I'd much prefer them to walk in the underwater treadmill and use the leg that way. And here's some, this is just showing ramps and retraining her proprioception and muscle strength and doing a few little cavalettis with her. And another, I think this is 9 weeks post-op. Yeah. So she's walking not too badly. So that's all that I have to share with you today regarding the non-pharmaceutical pain management.